name's Patty Saylor. Most of you know me. I'm part of SDAN and have been since the beginning, and have been working for people in self-direction for about 17 years. So we'd like to welcome you and thank you again for giving up your time so quickly. We've got a lot to share with you, but we really want to get some of your feedback as well on what's going on in your lives. So we're going to get Liz to start the PowerPoint just so we can remember what order we decided we were going to talk to you about things. So we do have a survey embedded in today's PowerPoint so we can get some feedback from you. It is a large group, so we really won't be able to do too much, having people speak, but certainly always put your questions in the chat. And we will have a question and answer at the end, certainly.
All right, then. So we are recording, just so you know. We're going to give you some updates, talk about some DDA changes, and toward the very end, some emergent advocacy needs. So again, please keep yourself muted, use the chat box for questions, and closed captioning is available for those of you who need it. Before we get started on the kind of the meat and potatoes of the discussion today, there's been quite a bit of conversation on our Facebook page and amongst yourselves about ARC's tax forms. First, the W-2 and W-2C. A lot of people have gotten W-2s that were incorrect. Most especially those people who are claiming difficulty of care exemptions, and so should have been taxed. It's an exclusion, not even an exemption. So you shouldn't have gotten a W-2 unless potentially there was some PTO or a small amount of PTO or some other non-direct service hours that you were paid for. If you did get a W-2 that was incorrect, there are W-2Cs, that's the corrected version, that is on the way. I have been tracking it. Looks like about half of the people may have them, and the other half of us do not. I would say I'm expecting, from the things I've seen from the ARC, probably within the next week. So by midweek next week, if you don't have one, I think we should be putting in tickets to make sure that we get them. So the other issue is really the W-4 and the MW-507 forms that the ARC was asking people to fill out potentially incorrectly. So everybody's tax situation is different, and I'm certainly not going to be the one to tell you how to fill it out. But the one thing I think we can all agree on is that we would want to fill them out honestly. And so in order to do that, read the questions, answer them honestly. If the W-4 and the MW-507 don't fit your particular need, and you do need to prove to ARC that you are qualifying for the difficulty of care exemptions, they have a new form, which we've put in the chat, which is basically an attestation saying that you are eligible for the difficulty of care, that you do reside with the person, and you can fill that in. They seem to be accepting those for people who are excluded from tax or exempt from tax. So figure out which one is the proper one for you, fill them out honestly, and send them back. I think that's all I need to say about that.
So for those of you that are not aware, there's been a leadership change at the DDA, right? So Deputy Secretary Bernie Simons retired at the end of the year, and Marlena Hutchinson is his replacement. Marlena has been working for Maryland Department of Health for 29 years in the Medicaid side of things. So she's now moving over as Deputy Secretary of Department of Developmental Disability Administration. She started on the job on January 10th, so she's not been in the role very long. Leslie Thompson is the interim director of programs. She took over for Nick Burton. He resigned and is on to other adventures at the end of the year. We've been in communication with the new deputy secretary multiple times. It's very brief communication. We've also been in touch with the Secretary of the Department of Health, Secretary Herrera Scott, with concerns that have been happening in this interim period of time. Both have the Secretary of the Department of Health and the Deputy Secretary of the DDA have asked for our patience. And as she's only been in the job for a few weeks, I guess we've been at 2 months now, close to 2 months. And both have reiterated on multiple occasions, and I'll speak to about Deputy Secretary Marlena Hutchins has spoken out multiple times, and I've heard her myself. Any of you that listened in this morning to DD Day would have heard her also proclaim her commitment to transparency, collaborative partnerships with individuals and families, support to individuals and families, and a desire to meet the needs of the individuals. So we've heard that commitment. We also heard on multiple occasions that under her new leadership, they are doing what they call an end-to-end mapping of all policies and procedures. They're looking at everything from start to finish. Getting a real assessment of the complexities of the waivers and the systems that are in place. We know that that's going to turn into something we probably won't like, but they're looking at everything. So words only go so far. And in the first 2 months of this transition, we've heard a lot of words about collaboration and transparency. But all meetings with advocates have stopped. We used to be meeting with DDA every week and meeting with the Deputy Secretary and his team every month. So this is our current observations in the juxtaposed with the statements that we're getting. So all meetings have been indefinitely suspended with the ask that we just give her patience, right? Well, your lives haven't stopped. Our lives haven't stopped. And problems are continuing in the interim. We know that people are getting cursory responses from emails as we email DDA on certain issues, from the top to the bottom, from headquarters to the regions, that, thank you for your information. We'll look into it, but no resolution. So we know the communications have been curtailed. We know that the phone calls, it's difficult to get somebody from DDA on the phone. And if we do, it's difficult to get any substantive conversation or any problem solving. If you are experiencing any goodness here, we really want to hear about it. If you are getting problem solved, if anybody is responding to your emails on the DDA level, we are not talking about the FMS right now. We're talking about DDA. We do see reversal of procedures. We're going to talk about this, what we're seeing, and I think that a lot of you are the ones giving us this information. So policies and procedures changing within this time period without any communication. None of us are seeing any emails from, constant contacts or any webinars from DDA or any other mass communications on the fact that they've changed some processes that affect us. So some of the processes in the past, what we worked through with DDA over the last couple of years was to streamline things, make them more efficient, and make things be more user-friendly. So there were many things that could be done at the FMS level, such as a budget mod or a request, a wage request, a wage change request. And a few other things like that could be done on the FMS level so that it could smoothly run. Those have all been taken back in-house to DDA. And we know that that's causing delays, and we're very concerned about that being a very big backlog on these requests that you have in, and what will happen as those requests suddenly, if they are approved, flood the FMSs, and then the backlog will be with the FMSs.
So we've gotten several reports from membership, and one of the reasons we wanted to meet with you all today is to find out what else is going on that we might not know about. So here are some of the things that may or may not have happened to you, but denials of previously approved services such as 2-to-1 or overnight supports, that although there was a 8% approximately 8% COLA added to the LTSS rates in January 1st. And some of you may have noticed that the increase appears in your unallocated fund amount, that people are being told that those rates are not available to be used for our vendors because the DDA has not updated their published reasonable and customary rates, not to be confused with wages, but the rates that vendors charge. Such if you have somebody that you contract with for some day hab or an activity, a place that you go for an activity that charges a rate, or a nurse who may be new and charging the rates as of January 1st. It could be behavior analyst that you're working with. It could be your support broker, any vendor who would be entitled by all rights to charge the new rates. Self-directing people are being told that they cannot pay those rates because the reasonable and customary rate chart has not been republished. We are hearing of substantial delays and denials of individual family-directed goods and services. I think somebody already put one in the chat that by all rights should have been approved and wasn't. Budget modifications, as Patty was saying, the small ones where you're moving from one service to another, personal supports to CDS, that kind of a thing, that the FMCSs were allowed to do in-house. Everything has been taken back, so I'm hearing severe delays in the budget modifications, more delays for that particular category than denials, but a lot of significant delays there. We had heard up to, I don't know, 700 or 800 of them in a queue. Employee wage changes and exceptions are also being reviewed, and specifically anytime you put in a wage changed with a retro payment that was longer than 7 days, which is almost impossible not to hit a 7-day one, but so that's what we understand. All of those, if you put in a raise and you don't do a retro, it still is going through the FMCSs. If it has a retro, anything greater than 7 days, it's going to DDA, and so that is causing also considerable delays, and obviously then making the retro payment bigger and longer. So this is where we want to hear from you. Those are some of the things that we have heard already. If it's happened to you, we want to know about it. If we didn't ask about it, we want to know about it. If you find in the poll there's no place to put your specific thing, and it's generic enough that you can put it in the chat, put it in the chat. If it's personal, please feel free to email us at info@marylandsds.org. So I don't want you to share any personal information in the chat for everybody, but if there is something that you can report that we didn't cover in the poll, please feel free to use the chat. And now I think, Liz, we're ready for the poll.
While she's working on that, somebody asked why are these things happening? It would be conjecture and opinion on our part if we answered why. We know that there's just there's new leadership and things are being done differently. Just letting you know that. Can't really answer why at this moment.
We can see the survey, so let's all take a minute, fill out the survey, and we'll give you a couple minutes.
As we make decisions about advocacy in the next week or two, your answers here are paramount of importance. Because if we can say, 65 people had this issue versus, we heard this, then it matters. So taking these little surveys really does make a difference. And it often informs our decision whether to escalate our advocacy beyond, the working level, which I don't even know what the working level is right now because they're not meeting with us, but we'll see. So thank you so much for doing these polls and giving us this information, and anything else you want to put in the chat. It is very, very helpful.
And it's looking like, just to give you some cursory information, because I'm not sure I see all of it, it looks like of the people who answered about the being able to pay vendors the current rate, 37% of you said they can't. Only 5 said you could, and the rest weren't sure. In terms of budget modifications, have you been denied any of the following? So about 13% of you have been denied budget modification, which is interesting. I didn't know there was denials there. Denied staff wages, denied some individual family directed goods and services, denied previously approved services, something else, 9%. And I don't know, Liz, you might see that as the runner of the survey, but I don't know what those things are, but that's very helpful to know.
I can share the results when we end the survey.
So the person who said they haven't been given a notice of COLA being available to you, I don't think you would have gotten any notice. As you remember from earlier in our conversations, we're not hearing anything. We're not getting these, weekly emails that we used to get. We're not really hearing anything at all. If you go to your CCS and ask them to check your unallocated funds, you should have seen a bump in the unallocated funds by the amount of the rate increases. So that would be the only way for you to be able to tell at this point. Okay, so we can see that a large proportion of you are having unresolved issues of one kind or another. We wanted to, not highlight all the issues and not talk about ways to advocate individually. So of course, your support broker is a great advocate and your CCS as well. Together, you all can contact the regional DDA office and advocate there. You can write to the Deputy Secretary, Marlena Hutchinson, and you can switch and write to the Secretary of MDH, Laura Herrera Scott. Those things had been working in the past. I will say, I would say they're all worth a try, and definitely do the CCS and the support broker in the regional office. But when all is failing you, writing to your legislators is a great idea. And the governor has a survey. There's 2 surveys. One appears at the very bottom of most of the emails that the state sends out. In the very tiny letters at the bottom, there's a link to a survey. That survey is fairly short. It can be anonymous or not. If you don't make it anonymous, somebody from constituent services would call you and talk about your problem. They probably would suggest that you call DDA and or MDH, or that they would refer the problem to DDA or MDH, which is okay. But the reason you were contacting them is because that hadn't worked. The theory here being, if enough of us do it, somebody will see that there's some unanswered questions, and enough of them to make them take a look and see perhaps that the current processes that are being used aren't particularly functional. So that's the on the issues we just talked about. This next slide, Liz will talk about a current advocacy issue. So this is pretty big and fairly new. There is, so I'm learning all the time, and I've just recently learned that the governor needs to put forth a budget, and the budget in Maryland needs to be balanced. And so one of the ways they do that is to create this Budget Reconciliation Financing Act, or as everybody's referring to it, a BRFA, which allows the state overall to adjust and become a balanced budget. I suspect that the governor goes out to their various secretaries and asks for assistance in filling this out. In this case, and the importance to us is that in this BRFA, there is 1 or 2 lines that allow DDA to reestablish an arbitrary limit on our individual family-directed goods and services. It appears from a budget analysis that came out yesterday that that number would be the $5,000, and they would be going back, it appears, to a $5,000 limit on individual family-directed goods and services. That is directly in contrast to the bill, the Self-Direction Act of 2022, that you all worked so hard on, that we had a 6-month summer study where the DDA and MDH, as well as legislators and families, stakeholders, and a lot of advocacy groups worked hard for 6 months and passed the Self-Direction Act unanimously. So in the 22 session. So this flies in the face of that law, and apparently if it passes, it will supersede those sections of the law. It's important for 2 reasons. One is that limit is arbitrary. These funds are not extra funds. These funds come from the person's assessed need and the concomitant budget that goes with it. And the other piece of it, as you probably know, DDA, when they were redesigning the budget form, decided to put the day-to-day administrator into IFDGS, Individual Family Directed Goods and Services, and establishing a $5,000 limit there would be contrary to the bill and the purpose of it, which is to allow a person in self-direction to maintain and to sustain the ability to self-direct after a family members aren't there to help them. So that was the initial goal of the day-to-day administrator, was to make sure that that a person could stay in self-direction. It would sustain their ability to do that. Somebody who would look after the administrative issues that maybe families would do while they were capable of doing that. So the other piece is, again, when people's budgets are formed, you have an assessed rate, you have an assessed need, certain number of hours of service that have rates associated with them. You multiply them out, you get a budget. In that rate is a wage for a person, mileage for the person. There would be any kind of benefits for the person, but there are also things like administrative things. And this administrator, day-to-day administrator, is one of them. And there's also program cost, where we can pay for classes, activities, and such. So limiting the IFDGS really flies in the face of the act that we all work so hard on, that you all showed up for and lobbied for, and it will put people in some people in real hardship. The committee hearings for these 2 bills are next Thursday and Friday in Annapolis. It is the House Appropriations Committee and the Senate Budget and Taxation Committees. So some of our members live within the districts of the members of those committees, and it would be especially important to reach out to them. But it's important to reach out to them in large numbers. So we are going to be putting together our thoughts and testimony, a guide to how to contact your legislators, how to figure out who your legislator is. And we are asking today for you to start thinking about who your legislators are, how individual family directed goods and services, a limit on that might affect a participant. Those of you who are support brokers, please reach out to your families and talk to them about ways that they can express their opinion and advocate for what they need for the participant. So I think that kind of wraps up the idea of it. I think an attempt to undo the will of the people and the legislators who worked really hard for years with a no notification to any of us, no input, just sort of insert a line in a semi-obscure document and hopes that it gets through. This doesn't feel very good. So We will send you the BRFA and at least the budget analysis that was done by legislature. They analyze every bill for the financial costs of it. So you guys can read it for yourself, page 12 and 13. And we'll provide all of the information as well as some bullet points, some thoughts about individual family directed goods and services, it's intended to do. And then you guys come up with what it means to you. And Patty, I think you might have something to say.
Yeah, I wanted to just bring up for people who don't know. So this is proposed legislation. It's going to be heard in committees on Thursday and Friday next week. So that's one place to intercede. If we can fill those rooms, they notice. The head of budget and taxation is Guy Gazzone, Senator Gazzone. He loves the DD community. He needs to see us in the room. Secondly, the DDA, if this does pass, the DDA cannot simply make the change. It is in the waiver, all three waivers, that there is no cap on the IFDGS and that the day-to-day administrator service and description is already in the waiver. So the DDA would have to write a waiver amendment, send that off to the CMS and wait for approval. So none of this can happen quickly. And if you have an approved plan, it's still in place. So there's time to intervene here. But unfortunately, this is abrupt because we just saw this analysis yesterday, the page 12 and 13 of this analysis document that you need to take a look at. So, and we will be sending out emails to give you information about time, place, location, where to be, all that. But as some of you know, when we fill a room in Annapolis, they take notice. That is exactly what we have to do. So intervene at this point. Then if this one doesn't work, then we intervene when the budget of the waiver amendment is written. And that'll be down the road a piece.
Sorry to end it on work for everybody. But it's really important that we all band together and advocate for for what we need. I know people have their hands up, but it's really hard to do it that way. So if you have some points you want to make, it'd be great if you would put it in the chat and we'll try to discuss it. I think we can go to questions at this point. We will be coming up with an email, so you don't have to, excuse me, fret too much right now about the how-tos. Liz is really good at setting it up with links embedded in the email, how to find your legislator, how to what kind of things we're going to want to talk about. So somebody just asked, when would the limit on IFDGS be effective if it's passed? If they are going to, the current waiver says there is no arbitrary limit on it. It is limited, however, and this is a big point to make with the money people in Annapolis and these committees. It is limited by the amount of a participant's total budget, which is based on their assessed needs. So it's not an unlimited amount. It is quite limited by the person's budget. Back to the question. So if, in fact, the BRFA laws pass, the DDA would have to go back to CMS and amend the waiver. Typically, they have to write it, and then they have to give a 30-day notice period, and then CMS approves it. And there's just no way I can tell you how much time that is. I know Patty said, whatever your approved plan is now, it should, hold to the end of your approval year. But we are hearing a lot of people are getting IFDGS denials. Can't say as to why that is. Is it an inappropriate ask? Was it not asked in the appropriate process? Or is somebody making different decisions than they were, 6 weeks ago? I don't know the answer, but it's worrisome, I think, that all of a sudden we're getting a lot of denials there. Let's see. I'm just going to go back a little further. Somebody asked if the day-to-day administrator is taxable. I believe it is, because the only thing that meets the difficulty of care is direct care, and the day-to-day administrator is not that. Athena or Liz, if I said anything incorrect, please jump in.
That would be day-to-day administrator as employee. Day-to-day administrator as vendor wouldn't be taxed.
Would be taxable as an independent.
Right, as an independent contractor.
Right. Thank you. Very well
People
done.
This is really hard to hear, and there aren't answers right now. So try not to panic. Try not to worry. Nothing can happen overnight. Keep working your process. Keep working with your CCS and your support broker. We just need to tell you that the tide's changed a bit. Okay, there isn't, somebody asked, what happens if I already hired a day-to-day administrator? Well, we can't answer that. You have a plan and it's in place and it's approved and those people are getting paid, hopefully. So that just continue to work your plans and stay in touch with your CCS and support broker. We will continue to update the deputy secretary. As we are right now, we are continuing to give her updates of all your issues every week. And we hope that she'll re-engage with us in meetings. Don't think there's any malice happening here. She's busy and she's been on the job for 30 days or so. So we really hope to establish a more working relationship and so we can work out some of the details. But right now we have this legislative issue that is, the hearings are next Thursday and Friday. So we have to jump on that. The other things and how they work out over time, we'll keep you informed. We're just going to keep trying to, go back to DDA and work things through, negotiate the way we have for the last, 4 or 5 years and see, but don't panic. They can't do anything to you tomorrow. So just keep doing your plan and submitting your requests. Some will get through and some won't.
I saw maybe a correction, or at least a support broker's experience is that most of the IFDGS requests are going to the regional offices. So if you've gotten a denial and haven't spoken to your regional office, that might be a great place to start. And then, you can go try Christy and Leslie. Then I'd keep going up the chain. And then the same support broker, I want to mentioned that she's not seeing approvals of retro pay older than 2 weeks. So I don't know if other people are
Could you give an example, Alicia? Why would somebody be doing retroactive pay? Just give somebody a real life example.
So currently the biggest example to go backwards is this COLA was approved and available on January 1st, 2024. And so money was added to a person's unallocated funds. Make sure you check that it's there. And so they might want to give their employees a bit of a raise effective as of January 1, but they didn't know this until, I don't know, maybe today. They would have a reason, like I would go back, you could go back and ask for a retro payment, till January 1 when you realize the funds were there. Or it might be that you realize the funds were there and it took you 2 weeks to talk to your CCS to fill out the forms and to submit them. And you had already talked to your person, as soon as we get this COLA January 1, giving you a buck raise. And then it took 2 weeks to get the paperwork in. We were told if the paperwork goes into, this is just the ARC, I don't know how the other two are handling it, but if the paperwork went into the ARC and they were the holdup, that would not count against the retro amount, the length of time of the retro amount. Does that help? Is it a legit thing? Like you just took 2 weeks to get everybody together and figure out how to put the papers in, how to do the budget mod, get the budget mod approved, move the money into the right spot. There are some 7 days, very short period of time. Let's see. Somebody asked if the new wage and rates are available yet. As far as I'm aware, as of the last 2 days ago, DDA has not published new reasonable and customary rate charts or wage charts. Neither have been published since last July. there seem to be quite a few FMCS issues, and I don't want to give them short shrift because we know they're still happening, and we know that some of the things that were promised with the rapid response team and some of the things that were going to be the 60 to 90 days and the 90 to 180 days didn't actually happen. Those are real problems. There are vendors who aren't paid. There are mileage issues that aren't paid. And I think that goes to the general advocacy that we were talking about before. You know, you try your support broker, your CCS, you go to the regional office, you go to the FM, you go to put your tickets in, however the individual FMCS works. If all else fails, you know, you keep working your way up the chain to find success. But we have not forgotten about the FMCS difficulties.
Well, so not only have we not forgotten, though, like I said, we are giving a written update to the new deputy secretary every week, just keeping the issues in front of her. And some of those certainly are the FMCS issues and the payment and payroll and the inability to see accurate budgets. So even if they aren't going to engage in dialogue, excuse me, with us, we are still sending weekly updates of what we're aware of.
Thank you. There's also an interesting thing here. We have seen, Patty especially had commented on this to me yesterday, that the DDA calendar is virtually empty. And another support broker has commented there's no initial trainings and no renewal trainings. So what is to happen to people who need to renew their support broker certification? In the meanwhile, I think we'll add that to our Marlena letter this week. Let's see.
While you're looking, Alicia, I'm going to go ahead and bring up an issue that's come to our attention from many people over the last week or two. It only affects certain people, but if you qualify for REM and have REM medical assistance and have skilled nursing, DDA is now denying your nursing support services through DDA. You will have to choose almost whether you're going to keep REM or whether you're going to keep the DDA services. So it's much more complicated than that. But there's a call right now out to like gather people. So if this is a subject that you are dealing with, there's some people, put your names in the chat, connect with each other, because the only way this is going to, it's not going to be an easy answer. The only way this is going to get tackled is if you band together. So if you have the issue of REM private duty nursing and DDA denials of service, it is true the waiver says you cannot have nursing support services from DDA at the same time of REM skilled nursing. But it's a much more complicated issue. So just try to connect with each other through the chat, and we'll try to bring people together to form a group.
Somebody was asking about the time and location of the hearings next week. I believe they're both at 1 o'clock, one on Thursday, one on Friday, and they're in Annapolis. And we'll have details in the email about that as well. Let's see, keep going. Somebody was asking that, so you have to put in a wage exception if you go over there's a minimum rate for a wage and a maximum wage. There's a minimum wage and a maximum wage, and then there's the exception wage. And so if you're over the maximum, but still within the exception rate, that's when you would have to fill out one of those forms. I don't know if this new limit is put on, what would be the effective date of it, whether it would affect plans already approved or not. That would probably be in the waiver application if we fail to get it stopped beforehand. But I'm counting on everybody to help us just quickly end it. Let's see. Yes, we're going to try to provide either a template or at least some talking points, so you can, kind of get some ideas and personalize it and make it your own. Really, I think it's a numbers game, as Patty was saying. The number of you who, sit down and just call everybody on there, there'll probably be, 15 calls. And just and you can email them all the same thing, and just make a call. I'm calling to ask you to, strike line blood, whatever it is of the BRFA. Please don't put an arbitrary limit on IFDGS. And I like that arbitrary word, because I think one of the things that potentially government is uncomfortable with is the word unlimited. And I want to make sure that we make these financial people who are looking at this bill that this money has already been allocated to an individual. It's a matter of being able to access it. It is not coming from additional money coming from another source. It's already earmarked with that participant in mind. So it's not additional funds. It's not unlimited. It's limited by the amount of that person's budget. So putting an arbitrary limit on it, limit for no reason having to do with what the person's needs are, is, unreasonable. Or at least you can make a very good case for that. All right, I'm going to skip down to some of the newer message. There's a group that's talking about the REM situation, passing each other's information on. That's great. Okay, so so if you had a new wage and it hit the exception number, DDA is reviewing that, we are hearing. There's a lot of people interested in the REM thing. I hope whoever's pulling that together will have saved this. But
Rachel Sullivan, she volunteered to keep track of all those names and maybe.
Oh, good. Okay, together. Great. All right. Support broker hours. The bill allowed up to 30 hours support brokerage based on the amount of funds that a participant would have, and the amount that was unallocated after wages and such were paid. So I think they can push back, but according to the bill, the law says you have that right, and the waiver does too. CMS does have a 365 or 364 day back window that they can use. So it would be a DDA decision to do it or not to do it.
Well, they're a little bit they're two different issues. So the CMS says that the FMCS can bill all the way back 364 days. That's not the same as the answer of a retroactive increase.
That's right.
And DDA is concerned about that retroactive wage increase, not the fact that bills would be paid, all the way back for the full past year. But so we'll see what DDA does with that. They're looking at it really closely.
I think we've hit most of the questions. Well, I said that, and then I say 13 new messages. So let me just go back to the beginning again and make sure I got them all. All right, thank you, Rachel, because that looks like the I can't talk about the GTI mileage change. Liz, is there do you know about that? And you could help.
What's the question?
So somebody said, can you talk about the GTI mileage change? Has there been a mileage reimbursement change in how you're putting it through?
Not that I'm aware of. Okay. You put it through the kind of like a shift and put it in the notes. That's the process, I understand.
Okay, so I was one who asked this question and raised it because I heard this from GT yesterday. One of the representatives that I was on the phone line with. And according to that person, we have never used the note section of the app. My employees have always used when they enter all of their caregiver hours, they put those in, and then there's a separate entry for actually putting the actual mileage.
Yes, that's how it's typically done.
Right.
They're correct.
What they are requiring now is that it's going to be entered instead. They're eliminating that separate entry, and it's going to be actually entered into the notes section is what their requirement will be. And then within that notes section, they will be manually entering it into their system.
Right. That's
So
how it's always been done. I'm sorry, we really can't spend a lot of time on
I don't want to, but it's not how they've always done it. So I want to really clarify that. This is a new process, please. So I just put it out there. I will stop, but it is a new process.
Okay, thank you. Well, Liz, maybe you can say this. So the question is, just to be clear, would the COLA, the January COLA, only take effect when we start our new budget, or would the COLA come in mid-budget and be as I can answer this one, be as unallocated? So it would have first appear as unallocated, and it would take a budget modification to allocate it into the various budget line items. There you go. I was smarter than I thought.
Yeah, it just shows up, but we're not really clear on how it's showing up, the one from January, or if it's showing up. I think that's another issue.
It does show up. It shows the funds show up in unallocated funds. At least I've seen them on a couple of occasions. But what we are hearing is that you can't necessarily use them. So that they haven't allowed people to use them. The new vendor rates, for example, people are stuck using the July vendor rates. Is that accurate, Liz?
Yes.
Oh, and also, do you want to mention your nice little catch about the decrease in the rate for personal supports?
It wasn't a decrease in, right. So I took the LTSS rates from July 1 last year, and the LTSS rates, the new LTSS rates, which reflect the COLA, January 1 COLA, and calculated how much the percent of changes. Most services saw an 8% change, which is what we expected. Some saw none, which was kind of, they weren't direct wage services, but personal supports saw only a 2% increase. So we're looking into that as well. So when you get a new, when you renew your plan or you're doing, and you notice that personal supports did go up, it actually kind of, in some cases, went down. That's why the rate went down. So.
Okay, I feel like we have covered everybody's questions for the most part here.
Sorry, I misspoke that it went down 2%, right? I'm not thinking straight today. Got so much going on. Did it decrease 2%, Alicia?
Well,
it only went up 2%.
I think you had said that
decreased.
It didn't go up, and that it went down by 2%.
Right, that's correct. Personal supports went down by 2%.
Right.
There was another issue with the 2% on personal, but that was a different issue. So yes, it went down by 2%.
The only reason, last question, somebody asked, how do you get access to LTSS? At the moment, the only way to get access to LTSS is through your CCS. Part of the Self-Direction Act was that there was going to be an increase in transparency and participants were going to have access to LTSS. I sat in a work group for that and went through some of the things with the software developer over a year ago. We were promised it last August, and then we were promised it again, last May, last August, and then again this January, and we still don't have LTSS access. And I don't know why, but that has been one of the things we asked the Deputy Secretary to look into it. It was ready for release last I heard. Last meeting with Deputy Secretary Simons, that meeting, they said it was just about ready and probably would be released in January, but not so far. But that also is in keeping with the lack of communication that we're experiencing right now. So, yeah, I think you're right, Irene. Health copays were never allowed under the waiver. So some people may have gotten it by mistake, I guess, but it's my understanding that wasn't an allowable reimbursement. All right. Well, thank you all. Please do expect to hear from us by Friday. I'm hoping to get something out tomorrow. And I hope that you'll look at your calendars and mark off one of the other days, if not both, for next week, to come, to show up and just, it can be a rather passive thing, but if we all sit there and we all, Debbie Hammond produced some pretty cool stickers. So we all put our sticker on and we let the committee know we really care about this. I know you can all keep your fingers crossed that maybe some of our early advocacy will get through and we'll get a reprieve. But in the meantime, we're full steam ahead. So mark your calendars for next February 28th, 29th, next Thursday and Friday at 1 o'clock in Annapolis. And we'll make our presence known. Thank you so much again for coming. And we look forward to continuing our advocacy together.